Okay, so just before the break, we learned about drug use nationally as well as drug use here on the peninsula. But we also learned about something that's giving many struggling family members hope, and it's called Narcan.
No matter where you stand on the issue, it's important to know as much as you can. And so we are back with Mady Barker, Behavioral Health Director at the Somerset County Health Department, to learn the basics. And Mady, you know, the Somerset County Health Department really is pushing to get the public informed about Narcan.
Absolutely. We want people to have the opportunity to become certified to administer Narcan should they need it to assist a family or a loved one. We've also reached out to law enforcement because sometimes they are first on the scene of an overdose as well.
So that's the kit.
This is the kit that you will receive, and for the purpose of live TV, I have gone ahead and assembled this. This is a nasal application. We do not use needles. It's very easy to assemble. The medication would be inserted here, and you would simply attach the nasal applicator here. So you're ready to go at this point.
Okay, so show us how it's done.
Okay, what you would want to do is first attempt to arouse the person. So you would be, you know, can you hear me? Can you hear me? No response. Sternum rub right here with your fist. It's very uncomfortable. If the person is going to respond, they'll probably yell at you at that point. No response. Call 911. It's very important that you call 911 before you administer the Narcan. Absolutely. To administer it, you're going to tip the head back. You are going to take your applicator and insert half in one nostril, half in the other. Don't get concerned whether it's exactly half. What you want to do is get the entire dose in one side or the other. It will become absorbed through the blood vessels.
Right.
And that's how the person will then start breathing again.
And again, this is for opioid overdoses. You know, we keep talking about heroin, but it could be prescription painkillers.
Absolutely. In fact, most of our overdoses do not involve heroin. The overdose deaths, it's usually a combination of different opioid drugs. Heroin may be one of them, but they're not exclusively heroin.
Okay, so we've got some, Narcan's been applied. What can we expect to happen now?
Hopefully the person is going to become alert. If they don't, you're going to do rescue breathing for a few minutes. You want to pinch the nostrils, a few short breaths, 1 to 2 minutes, no response. Take out your other vial, insert it. You get 2 doses in each kit. Repeat the process. And then that's basically all you can do other than rescue breathing until the emergency responders arrive.
Is it true that when somebody is rescued with Narcan, they can become violent as they come to?
That's a very common misperception. They found that fewer than 1% of the people will actually become violent. They may wake up gradually. It may be more sudden. They will be in withdrawal. They can be agitated. They may be sick. They may be vomiting. But there are very few instances where they're actually violent and you need to protect yourself. You need to keep them comfortable until help arrives.
Now, once this is applied, you're not done. They still need attention.
They do need attention. It's a temporary effect. The opioids can reattach and cause another overdose at that point. It also is possible it wasn't an opioid overdose and medical attention will be needed for whatever that is. We encourage you not to leave the person until help arrives. If you need to, for any reason, turn them on their side, turn their head to the side, although his head doesn't turn, so that if they do vomit, they won't choke on them.
So again, just try to wake them up, try to arouse them, and if that doesn't happen, then you administer it.
It's arouse, 911, administer.
And
so then breathe in between.
There's things you got to know. So there are training sessions that are being set up for you. The Somerset County Health Department is helping you to understand. There's a training session coming up this Wednesday and Wednesday, June 17th at the Somerset County Health Department. It's going to be at 5:30. This address is important because there's a couple of buildings there. 8928 Signpost Road, that's in Westover. Make sure that's the address that you go to for that training session.
And it's after this training that you can receive a prescription for Narcan.
Absolutely. You will leave with a prescription and with a voucher that you can fill at a local pharmacy. There'll be no cost to you to receive this rescue kit, which could save someone's life.
Mady, thank you so much.
Thank you both so much.
And if you would like to learn more about Narcan training, and the Somerset County Health Department, just go to our website, WDOT.com, and click on our picture at the top of the page.
So this is always good information to know just in case you need to be there to help. So coming up next, we're going to learn how we can help our community enjoy our many talented local chefs and sample some delicious food all at the same time. Plus, we are in the Delmarva Live kitchen making one of those tasty dishes, summer chimichurri shrimp tacos. Delmarva Live, we'll be right back.